Are falls preventable or inevitable? 1 in 3 adults over the age of 65 experiences a fall annually. That's a staggering statistic, isn't it? But what's even more concerning is that falls are the leading cause of hip fractures, which can severely limit your mobility for years. You might have heard the news that Mitch McConnell is hospitalized after a fall, and this isn't his first time. This risk of falls doubles after experiencing a stroke and increases to 6 to 8 times if you're living with dementia. The annual management of each fall costs about $65,000 to the healthcare system. Each year, 3 million older people are treated in the emergency departments for fall injuries in the United States. And the cost of treating these injuries is projected to be over $101 billion by 2030. Now, there are many exercise-based programs designed to reduce fall risk. However, we still have thousands of people slipping and tripping every day. That's why my team and I at the Cognitive Motor and Balance Rehabilitation Laboratory, or the Cog Mobile Lab as we call it for short, are committed to teaching seniors how to prevent falls in daily living. So how are we doing this? We use technology that simulates slips and trips. A slip most likely will cause you to fall on your back, whereas a trip will lead to a fall in the forward direction. Our extensive research over the years has enabled us to identify the key factors that cause falls. If you come to our lab, you will be put in a mountain climbing harness and experience about 40 slips or trips, or even both, without hurting yourself. The purpose of this task-specific training is to teach you implicitly how to react and respond if you start to fall, so that you recover and don't wind up injured on the ground. We might also teach you to equally focus on how you walk and what you pay attention to, so that you are less likely to experience a slip or a trip. For example, after this training, if you're walking on a sidewalk and suddenly encounter an icy patch, you will find yourself responding by immediately taking a long backward step to prevent yourself from falling. That's just one example of a learned strategy. A single session in the lab works like a vaccine. It helps prevent falls for a year or more. Isn't that a beautiful solution to a problem so huge? This research has brought about $15 million of funding to the university over the past 15 years, and we expect to attract much more. It has been a humbling experience to have my work cited more than 4,000 times in journals throughout the world, and to receive global recognition as a speaker, or simply be known as the fall guru. But we're not stopping there. We're also examining how the brain actually controls and prevents falling. Our recent 5-year NIH grant uses imaging technologies to examine brain networks and how they associate with the prediction of real-life falls. One of the most exciting inventions coming from our lab is that we can now take a video of someone walking and feed it into our FRATS application to get a fall risk score. We can tell you that they'll have as much as a 90% chance of falling or only a 15% chance if they were to encounter a future slip or trip. That's pretty cool, isn't it? This predictive modeling using machine learning will help us to develop individualized training programs depending on the type of risk identified. We invite you to visit our lab and check out your fall risk score. Going forward, the goal is to translate our research and training programs from the university into the community to ensure that seniors can live safely and independently. Over the last 10 years, we have had 1,500 participants ranging from healthy older adults to people with a stroke or people living with cognitive impairments go through several clinical trials funded by the NIH. We look forward to working with you so that at the very start of this community outreach, we can reduce the number of emergency visits to our own hospital system. Our research has the potential to make a significant impact on the lives of millions of seniors, save thousands of dollars every year, and most notably, make this urban campus safer for all of us. Thank you.